Welcome back, everyone, to Medica's video podcasts yet again. My name is Varun. I am the one representing these Medica's video podcasts as a host. Medicas is an e-health platform available in India, United States, and Caribbean regions, offering online doctor consultations as well as lab tests to businesses as well as to consumers that are available in these countries. So the topic for today is teeth sensitivity. There was a survey conducted by National Institute of Health on about 315 participants, and they identified 40% indicated they have experienced pain, sensitivity, or discomfort in their teeth. There are a lot of reasons behind it. There could be a lot of possibilities. We may start experiencing teeth sensitivity at any given point of time in our life, and this has been a very trending topic and a very important topic because at the end of the day we human beings can't stop eating and can't stop consuming various food. So if our teeth continues to become sensitive to anything that we eat and gulp, it is going to make our life very difficult. So let's talk to Dr. Tejaswi Kammela. She is a cosmetic dental surgeon from Visakhapatnam. She has received gold medal presidential award from NTR University, Andhra Pradesh, who is going to throw some light on this topic, which is teeth sensitivity. So without wasting any time, let's welcome Dr. Tejaswi Kammela. Good afternoon, Dr. Tejaswi Kammela. How are you doing today?
Yeah, I'm good. Good afternoon.
Good afternoon, ma'am. So, ma'am, I hope you know that we are talking about teeth sensitivity. So, we have a lot of questions around teeth sensitivity. What is exactly teeth sensitivity? Are teeth sensitivity issues normal? Does teeth actually become sensitive when it has any cavities in it? Why teeth are sensitive after filling? Which teeth usually, we have around 30, 35 teeth, every one of us. Which of them is actually sensitive? How does sensitive teeth feel like? When does teeth become sensitive? So likewise, we have a lot of questions, Dr. Tejashwi. So
Yeah.
before we actually get into these questions, we would like you to please introduce to our audience, and then we will directly dive into the subject for today. Please go ahead, madam.
Yeah. Good afternoon, everyone. I'm Dr. Tejaswi Kammela. I am cosmetic dental surgeon and I have received two gold medals from the NTR University. Present working at Royal Smiles Dental Clinic, Palam. It is well equipped clinic. It is very hygienic as well. So today my topic is about dental hypersensitivity. This is the most common problem we face in everyday life. The main problem, the main cause for the sensitive teeth is due to because everyone don't know the proper method of brushing, improper brushing. People feel because of brushing hard, your tooth looks clean. But because of that, the layers of the tooth, the first layer which is called as enamel, gets eroded, the wears off. The next layer, which is dentin, is the most sensitive layer, which is yellowish in color. Because of that, when the tubules get exposed, you will receive a lot of sensitivity, mainly to hot and cold beverages, for sour food, and acidic. The tooth becomes acidic. And more other problem is because of dental erosion. The erosion is mainly due to the food we intake. Mainly citrus fruits causes lot of tooth erosion, and people who have gastric reflex causes tooth erosion. And the other main reason is gum disease. You see people having recession of the gums. Gum recession causes very sensitive to hot and cold food because the root surface which is exposed will lead to hypersensitivity. And sometimes people will have cracked tooth. Why do we get cracked tooth? Because some people use tooth as a tool, which is not good. Tooth should not be used as a tool. Sometimes the tooth might crack, which causes severe sensitivity because the pulp gets exposed. And one more teeth is tooth grinding. Some people have the habit of clenching the teeth, and sometimes, without their knowledge, sometimes people grind their teeth at night, which is called as night grinding. In our language, we call it as bruxism. These are the common causes of the tooth sensitivity. So let me tell you, how do you prevent it? Improper toothbrushing. You should not brush hard your teeth. Use a soft
Before we
bristle
talk
toothbrush.
about the prevention, ma'am, I understand
Yeah,
you wanted to discuss about the prevention. Of course,
yeah,
every one of us are actually looking forward for the topic of preventing teeth
yeah.
sensitivity. But I believe, ma'am, if I can recall correctly, olden days were always golden days. So
Mm, yeah.
grandparents and our parents, especially in those days, they used to eat a lot of hard food just by using their teeth. The sugar
Mm,
canes, especially what I'm talking about, the
mm,
groundnuts with
mm,
jaggery, we are talking about,
mm,
till seed balls, which they used to eat in the olden days and all. So for
mm,
some reason, we all, the younger generation has lost that grip in their teeth to even bite even a guava. You know what I'm saying? And they keep
mm.
complaining about their teeth becoming very sensitive. I don't think so. Our grandparents would have heard about this teeth sensitivity at all. What is exactly this teeth sensitivity, ma'am? Maybe we'll start there. Let us enlighten ourselves with the definition of what teeth sensitivity in a layman's terms, please.
Mm. See, in olden days, uh, the food habits for olden days and now, there is a lot of change in the food habits. And one more thing, the food which we are eating is full of pesticides. To be frank, we are not having healthy food. Everything they use pesticides and all. The pesticides which they are using, we directly eat from our teeth, right? We keep it in our mouth. It's
Right,
indirectly affecting our tooth. The main reason is our food intake, food habits. We are not having healthy food now, and the mainly now generation, everyone are having cool drinks, which has common main reason for our tooth damage, and sugary foods, more intake of sugary foods, refined foods. These all are the main reasons for this younger generation, which we are getting more sensitivity of the teeth. Even the
right.
young people are getting, yeah.
Right. So if you have to, based on your experience, Dr. Tejaswi, have to tell us what is the ideal age group of people who are getting this teeth sensitivity, as well as who are the people who are ideally visiting you for these teeth sensitive problems and everything else. So what would you say, ma'am, based on your experience?
The common age range is between 20 to 40 years, out of which women are experiencing more hypersensitivity than men.
Okay.
It is nowadays it is affecting even the teenagers and even the people above 70 years of age.
Oh, okay, okay. Ma'am, is there any reason why only women are being affected with more teeth sensitivity, unlike men? So, is there any reason behind it? Because what I believe is men use their teeth as a tool for a lot of things, which probably we should not be disclosing on this forum. But then again, I mean, women are very careful, right, when it comes to their teeth and all. But why do you think they experience this teeth sensitivity a lot?
Even women use tooth as a tool.
Oh, okay, okay,
Yeah,
okay.
the tailors and all, and
Oh,
mm, mainly due to brushing, hard brushing. Women and
okay,
men, both of
okay.
them, women mainly due to hard brushing.
Okay, ma'am. I also heard, from some people. I never had teeth sensitivity, but after I went for a dental procedure, like it could be for, I mean, the common procedures which everyone goes through are root canal treatments. And during root canal, you do a lot of things like fillings, because I got one root canal treatment and because I kind of know a little bit about it. Is it true that after dental procedures, teeth becomes sensitive? How true is that statement, ma'am?
No, actually, once after the filling, sometimes we clean the decayed part. No, as soon as we clean the decayed part and we put some varnishes and all, and we fill the tooth. No, after we call it as post-operative sensitivity due to composite fillings. Because of composite fillings, there will be little of post-operative sensitivity. It lasts for 1 week or so. That is quite common. And cavities which are very deep, which are very near to the pulp, those kind of teeth only will have little sensitivity even after the filling is got done.
Okay.
And after cleaning, there is a common myth that after cleaning, our teeth will become very sensitive.
Right.
See, I will show you one thing.
Sure.
Um, uh, the root surface. We usually clean the tooth. See, the calculus and all. The calculus is formed around the tooth.
Right.
This acts as a masking effect. It covers your tooth surface. The calculus is which is in yellow in color.
Right.
When you come to the dentist, we clean this part. Now this area becomes clean, and already your root is exposed. In this region, for 2 to 3 days, you will have little sensitivity because we have cleaned this area, and it will take little time to get settled.
Right.
Yeah, because of that, people think that because of cleaning only we got this damage. But actually, we are doing the good. We are cleaning the surface and we will help it in again recovering it. For
Right.
just 2 to 3 days, you will have little sensitivity, but you will gradually recover from it.
Okay, ma'am. Thank you.
Mhm.
Ma'am, I have one more question. This is actually a common question which most of us have. We have been brushing since the time we are aware of brushing is important and it has become a routine to all of us. And you also mentioned brushing, our food, as well as our gum health are extremely important when it comes to teeth sensitivity. What is an ideal way of brushing, ma'am? Can you explain us? Can you demonstrate if probably, if you already have some equipment around you?
Yeah, let me check this.
How long should we brush? How should we brush?
Question. Okay, let me show you.
Sure, ma'am.
Brushing. Okay, if this is your brush, you have to hold the angle of the brush in 45 degrees angle, and you should keep it like this. Rotate for 3 times in this region. It should cover 3 teeth at a time in oblique direction. Why am I saying oblique direction? Because at this direction, your gums will get cleaned. We usually brush like this horizontally, and we do very hard brushing. So if you change the angle of the brush to 45 degrees angle, you will cover the gums region as well, and the area it will get cleaned. You have to keep 3 rotations here. Every surface should be having 3 rotations,
Okay,
and
ma'am.
the time should be 2 to 3 minutes. You should
Okay.
brush even the inner surface
Right.
inside of the teeth, and upper surface also. Some people neglect the inside surface, only brush the outer surface, which should be avoided. Even the inner surface should be clean. Every surface should be covered 3 times.
Okay.
Okay,
Okay.
and the angle should be 45 degrees angle, and it should cover the gum region. So the debris which is present near the gums will be removed
Right. Ma'am,
in
how
only 2 to 3
often?
minutes.
Sure, ma'am. Sure. How often should we change our brush?
It should be changed within 2 to 3 months.
Okay.
It's better
Which?
if you change your brush every 2 months.
Oh,
And
okay.
if you observe if the bristles are getting abraded, you should immediately change your brush and your brushing technique also. That means you're brushing hard. So that's why your bristles are getting fade off.
Okay. Ma'am, there are a lot of kinds of brushes you find in the market, zigzag,
Mm.
different colors, soft bristles, hard bristles, medium bristles. Which one should we use, ma'am? Is there a ideal one or is this, I mean, because it is very confusing to pick up a brush and they
Yeah.
come at very different costs. There are brushes that you get for 10 rupees and there are brushes that you get for
Mm.
100 rupees too.
Yeah,
Which
yeah.
one should we pick up, ma'am? What is an ideal brush that we should pick?
Uh, Ideally, don't use hard brush because of hard brush, you think that the teeth will be clean, but it causes more damage. The debris
Okay.
gets deposited into the gums. So better to
Okay.
use soft or ultra soft brush.
Okay.
Any company is okay, but if you check the bristles, whichever is soft, it is better to go for it because the rating will be depending upon the company.
Okay. Okay.
Different companies give different ratings. Zigzag brush is also good,
Okay.
and
So,
soft and ultra soft is the best brush. Don't
sure, ma'am.
use hard.
Okay, got it. Ma'am, how about toothpaste? How far does a toothpaste impact on teeth sensitivity?
Yeah. Toothpaste mainly, the product potassium nitrate is the main ingredient which should be present in our toothpaste. Mainly for hypersensitivity patients, this ingredient, potassium nitrate, which helps in blocking the dentinal tubules, exposed dentinal tubules will be blocked by the potassium nitrate and fluoridated toothpaste. These two
Okay.
act as a hindering the hypersensitivity.
Okay, got it, ma'am. And how about food, ma'am? So, which food should we avoid when you have sensitive teeth, and when can we start, taking that food that we have avoided until this sensitive teeth is recovered, ma'am?
The main food which should be avoided is cool drinks. Very hot, very cold should be avoided. Mainly citrus fruits should be avoided. Citrus. If you want to take lemon juice or citrus juice, better use a straw instead of taking directly, because vitamin C is very important for our body. We can't say that avoid it completely. So better use a straw while taking these juices, lemon
Right.
juice or orange juices.
Okay, okay, ma'am. I
Hmm.
want to ask you this question also, Dr. Tejaswi. If you have a patient, let's say if anyone has teeth sensitivity and they approach your clinic, what is the first thing that you would advise, and how would you actually help them to come out of this teeth sensitivity? What would be your diagnosis and advice, ma'am? Can you explain us, please?
Yeah. If it is because of gum recession or because of more calculus deposits and gum recession is there, we will, and if the patient can't cooperate for any kind of treatment, first I would suggest to use the dental hypersensitivity toothpaste for few days or a dental mouthwash. Later we will do the required procedure. If the patient is having abrasions or attritions, abrasions in the sense that, I will show you
Sure.
some, if it is visible to you.
Yes,
Abrasions
ma'am.
are like this. It is wedge shaped appearance. If you keep your finger, it will go inside. These kind of things need fillings. They need
Okay.
fillings. Uh,
Okay.
See, so for severe attrition and common, for overall teeth, if they have attrition, some teeth might need caps or inlays, crowns
Right.
or inlays. The last option will be root canal treatment.
Okay.
When
Okay.
the pulp is exposed, only when the pulp is exposed, we will go for root canal treatment. Otherwise, the first procedure, first we will advise to use the toothpaste. And in office, we will advise varnish application or gels application, fluoride application.
Okay, ma'am.
Bonding agents will be applied in
Sure.
office.
Okay, okay. And are there any stages for this teeth sensitivity, like stage one, stage two, stage three? Are there any stages like this, or it is if teeth become sensitive, they become very sensitive? So how does it work, ma'am?
Stages in the sense, first we will be having little sensitivity to the hot or little sensitivity to the cold. Or while you're brushing your teeth, you will be having sensitivity. Then, if you identify it and immediately visit a dentist, you will be getting cured in the early stages only. And the last stage, as I told you, the pulp will get exposed. And it is a, see this one, this
Okay,
will be the last stage because the pulp is already exposed here. In this,
okay,
we should directly go to the root canal treatment only. There is no
okay,
other.
okay, okay. Ma'am, we also see some people have teeth in yellow color.
Yeah.
Why do people have their teeth in yellow color? What is the reason?
Yeah. Let me show you this chart.
Sure.
Yeah. Is it visible?
Not exact, not completely. Yeah. Yes, ma'am. Please go ahead.
Yeah, yeah. See,
Yeah.
this is the tooth structure. The first layer is enamel, the white one, which is the
Okay.
strongest in our body. Hardest one is the enamel. People think if we brush hard, if we brush for more time, our teeth look white. But what happens is this teeth surface will get abraded. Next, it reaches dentin. This is the next layer. which is yellow in color. The mostly because of this, your teeth appear yellow. Once you reach this layer, the yellow layer, this is the most sensitive layer, and you can't get white teeth back.
Okay. Okay.
Um,
Understood, ma'am.
yeah. And
Right.
yellow teeth, there are many causes for yellowish discoloration of teeth.
Okay. Okay, ma'am. What kind of an impact smoking and drinking will have on our teeth, Dr. Tejashwi?
Smoking causes a lot of impact. It causes mainly stains will be caused because of the heat. Smoking is obviously heat, no? It causes the recession of the gums. The gums will go away from your tooth surface. It mainly causes the sensitivity. And yellowish discoloration, brownish stains. Smoking causes a lot of brownish stains.
Okay. Okay. And when is the right time to seek help or to seek help? That's my first question. When you have sensitive teeth. My second question is how to maintain our, oral health to avoid teeth sensitivity. Like for an example, visiting, doctor. Because I don't know how often should we visit a doctor. That could be one of my questions too.
It is better to visit a dentist once in 6 months. Regular checkup once in 6 months, and you need to brush twice a day with fluoride toothpaste if you have sensitivity, or sensitivity toothpaste which has potassium nitrate in it. Choose a dentist recommended toothpaste. Use soft bristle brush to brush your teeth. And for some people, we advise mouthwash, sensitive mouthwash. And
Okay.
don't use alcohol based mouthwashes, which will
Oh,
again damage your teeth.
okay.
Alcohol based mouthwashes are not good. And don't use any mouthwash for a long period of time.
Okay.
Only when it is needed, it is required.
Okay. Ma'am, this is a fundamental question. I mean, after all these that we have discussed, ideally, which of our 35 or 32 or 26 teeth that we have are usually sensitive? I meant to ask in a layman's terms, are gums more sensitive than our front teeth? Which one of these teeth are more sensitive, ma'am?
Uh, the areas which we chew the most, we call it molars. They become more sensitive because every repeated usage of it. We use every day and we use hard food, everything. The molars and the mainly the lower anterior teeth.
Okay, okay.
Um, the lower anteriors get more sensitive.
Sure, sure, sure. Thank you so much, Dr. Tejashwi, for giving us some valuable insights about teeth sensitivity. So, ladies and gentlemen, I believe now that we have a lot of information from Dr. Tejashwi, it is very important we focus on our oral health. So, and it's also important we approach an experienced doctor like Dr. Tejashwi to ensure that whatever the oral issues that we have, especially sensitive teeth, are completely avoided by using, by following her instructions as well as the medication that she provides once we approach her. So Dr. Tejaswi Kammela, as I said earlier, she's a cosmetic dental surgeon. She is available on medicasapp.com, www.medicasapp.com. And you can also book an online appointment with her and also visit her office if you are in and around Visakhapatnam city. She is available in her office. You can see the office hours and also the timings that you can book your slots on www.medicasapp.com. And you can also download Medicas from App Store and Play Store. This is all we have for today. Once again, Dr. Tejashwi, thank you so much for your time, ma'am. You have actually given us a lot of information related to teeth sensitivity. We will again reach out to you for another important topic related to oral health. Thank you for your time, ladies and gentlemen. Thank you so much, Dr. Tejashwi. You have a good evening.